Hello, viewers. It's again, Miss Nelson. Today we are looking at stroke rehabilitation. Worldwide, stroke is among the leading causes of disabilities and deaths. We cannot therefore afford to ignore such a problem. A stroke, sometimes called brain attack, occurs when something blocks blood supply to parts of the brain or when the blood vessels burst. In either case, parts of the brain can become damaged or may die. A stroke can cause lasting brain damage, long-term disability, or even death. It can also be ischemic, which is about 80%, or hemorrhagic, which is about 20%. So ischemic stroke is 4 times more common than hemorrhagic stroke. For ischemic stroke, if treated within 3 hours of the first symptoms, there's a better chance of full recovery or reduced disability. Hence, patients who receive medical drug intervention in the hospital within these 3 hours are more likely to recover than others who remain adamant and reckless. During a stroke, every minute counts. So, by knowing these signs and symptoms of stroke, here is a quick action. Perhaps it could save a life or even your own. If you think someone may be having a stroke, act fast. FAST. Fast, here is a test code. F for face, A for hands, S for speech, and T for time. So here is the test. Ask the person to smile. Does one side of the face droop? Ask the person to hold out his arms. Does one hand drift downwards? Ask the person to repeat a simple phrase. For instance, how are you? Is the speech slurred or strange? Then the T. If you see any of the signs mentioned above, run as fast as you can to the hospital. In general, here are also some signs of stroke. There will be sudden numbness or weakness in the face, in the arm, and the legs, or on one side of the body. There will also be sudden confusion, trouble speaking, or difficulty in even understanding speech. There will be sudden trouble in seeing in one or both eyes. There will be sudden trouble in walking, dizziness, loss of balance, or lack of coordination. There will also be sudden severe headache with no known cause. Please kindly take note of the word sudden. These events or exposures predisposes one to this stroke. They are called the risk factors. Their age, that is if the person is greater than 55 years. In gender, more males have been seen to be more affected than the females. There could also be race and ethnicity. The genetics, also low birth weight. Other risk factors that can be managed are called modifiable risk factors. Amongst them are hypertension and heart diseases. In hypertension, standing as the most important factor that contributes about 35 to 50% of stroke risks. We also have transient ischemic attack or prior stroke or mini stroke. We also have diabetes. We also have dyslipidemia or popularly known as high cholesterol. We also have oral contraceptive use with estrogen content greater than 50 micrograms. We also have post-menopausal hormone therapy, and we have sickle cell disease. Others that also contribute to this stroke risks are the lifestyle factors such as cigarette smoking, excessive use of alcohol, physical inactivity, obesity, and poor dieting. Eating more of unprocessed plant-based food, low amount of red meat, moderate fish, dairy products have also been seen to be very, very important in reducing the stroke risk. Olive oil is also important in this risk reduction. So therefore, if your stroke symptoms go away after a few minutes, you may have had transient ischemic attack, also known as mini stroke. Although it is brief, Mini stroke is a sign of a serious condition that will not go away without medical help. Treating transient ischemic attack, also called mini stroke, is important. Make an appointment with your doctor today. Stroke rehabilitation should begin almost immediately with a multidisciplinary approach. In stroke rehabilitation, those with disabling stroke undergo treatment to help them return to normal life as much as possible by regaining, relearning the skills of everyday living. It also aims to help the survivor understand and adapt to difficulties, prevent secondary complications, and educate family members to play a supporting role. The main predictors of stroke recovery are motivation, social support, and learning ability. So therefore, the services of physiotherapists, physicians, and support from family caregivers ultimately decide the fate of the stroke recovery, especially in our society. Physiotherapist interventions in stroke management will help to preserve or improve the range of motion, muscle tone, muscle strength, bowel and bladder function, functional and cognitive abilities. Physiotherapy will also help to prevent secondary disabilities such as contractures. It will also help to improve the movement aspects, balance, and coordination. With the help of family caregivers, stroke patients should attend routine medical checkups where the physician evaluates the progress in their recovery and ensure that other diseases or complications are properly managed. Depression is a commonly reported consequence of stroke and is seen in almost 25 to 50% of patients. So therefore, counseling, psychotherapy, and responsible family care are needed for comprehensive management. Cognitive impairment is one of the biggest threats following stroke. Daily instrumental activities such as cooking, transportation, laundry, and managing finances may significantly improve the quality of life of these patients and should be encouraged. Caregivers should be properly trained on these tasks. They are meant to ensure patient adherence to medications, hospital visitations, and to support physiotherapists and other health personnel in delivering adequate and goal-oriented services. In conclusion, a stroke is a medical emergency. Poor attitude from crude ignorance can limit the chances of recovery. Unnecessary indulgence in spiritism and ancient practices have undermined the recovery in many stroke patients. Instead of rushing to the hospital for urgent care, they begin running around spiritual homes till chronic disabilities and possible death. There are two primary choices in life: to accept conditions as they exist or to accept the responsibility for changing them, by Dennis Watley. Remember, a stitch in time, they say, saves nine. Take care of your health today before it is too late. Thanks for watching.